Oh, you just sent the link to Dr. Chow?
Yes.
Oh, okay. We'll wait a minute.
Yes. I'll start with you, Commissioner Guillermo.
Present.
Commissioner Chow.
Yes, present.
Welcome. And Commissioner Green.
Present.
Great, thank you. I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples.
Okay, thank you, Mark.
Sure.
Yes, please. Yeah, please call the items.
Great. Item 2 is the approval of the minutes for the meeting of February 8th, 2022.
Thank you, Mark. I'm hopeful everybody had a chance to read the minutes and make any changes or corrections, and I'll call for a motion to approve.
So moved. Second.
I'll note there is somebody on the public comment line who would like to make comment. So before you all vote, let me read this first. For each agenda item, members of the public will have an opportunity to make comment for up to 2 minutes. The public comment process is designed to invite input and feedback from individuals in the community. However, the process does not allow questions to be answered in the meeting or for members of the public to engage in back and forth conversation with the commissioners. The commissioners do consider comments from the members of the public when discussing an item and making requests to the DPH. All right, first on the line. Actually, folks on the line in general, if you would like to make comment, please press *3. *3. I see one hand, so I'm going to go with that. But others, you're welcome to continue. Caller, you're unmuted. Please let me know that you're there.
Yes, it's Patrick Manette-Shaw.
Okay, you've got 2 minutes, Mr. Manette-Shaw.
Thank you. Regarding the February 8th minutes, I've noted since the beginning of the COVID pandemic that agendas for the full Health Commission and all JCC committees restrict public comment to a 2-minute period per speaker. This meager time allocation is insulting to the public you purport to serve, San Franciscans, whose voices are artificially stifled regardless of the complexity of any topic. Adding 1 minute to reach 3-minute public comments won't kill you. Delay your dinner at the French Laundry with Mayor Breed or Governor Newsom, or delay your tee-off time at the golf course. Please start extending comments to 3 minutes starting today. The measly 2-minute limitation reflects this commission's pettiness, which is inconsiderate to members of the public who seek to hold policy bodies in our government transparent and accountable to those you serve. The paltry 2 minutes smacks of free speech restrictions Russia's President Vladimir Putin imposes on Russia, in stark contrast to the heroic president of Ukraine, Volodymyr Zelensky. Please extend comments starting today to 3 minutes. Thank you.
Okay, thank you for that illuminating public comment. Anyone else on the line would like to make a comment? Please press *3. *3. Okay, commissioners, you made a motion, and I will do roll call vote for the minutes. Commissioner Green.
Yes.
Commissioner Chow.
Yes.
Commissioner Guillermo.
Yes.
Okay, thank you very much. The item passes. We can move on to item 3, general public comment. And folks on the line, if you'd like to make a comment about something that's not on the agenda, please press *3 now. *3 now. I see no. Oh, I see a hand. All right. Before I get to that person, I'll read another statement. At this time, members of the public may address the commission on items of interest to the public that are within subject matter jurisdiction of the commission, but are not on this meeting agenda. Each member of the public may address the commission for up to 2 minutes. The Brown Act forbids a commission from taking action or discussing any item not appearing on the posted agenda, including those raised during public comment. Yeah. All right, person on the line, I will put 2 minutes on the clock. Please let us know that you're there.
Yes, it's Patrick again.
Okay, great. So you've got 2 minutes, Mr. Monetshaw.
What about 3 minutes? Attending physicians who fail to document detailed discharge destinations in patients' electronic medical records should be suspended and have their hospital privileges revoked. Testimony DPH CIO Eric Rappin presented to the Sunshine Task Force on February 22nd that there's no, quote, regulatory requirement, end quote, to capture the name and street address of facilities SFGH and LHH patients are discharged to was comical. The structured database fields in EPIC to capture discharge destination and discharge locations should not be optional fields discharge planners can choose not to comply with or not to complete by entering discharge information only in a single memo text field for discharge summaries. The Health Commission should direct Rappin's IT team to make those structured database fields mandatory and required data entry fields, particularly for patients being discharged to subacute care SNFs. SFGH's JCO accreditation involves evidence-based standards to communicate a patient's care plan to their post-hospitalization care teams. Discharge plans and instructions accompanying a patient to their outpatient care setting should include detailed information about where they are being discharged to, regardless of regulatory requirements, and should include a list of their medications and types of care they will receive post-discharge. Medical record staff should flag patients.
Well, thank you for your comment. If anyone else like to make public comment, please press *3 now. All right, commissioners, that is all the public comment. We can move on to item 4, the executive team report.
Good afternoon, commissioners, and good afternoon to everyone joining us on the line as well. Thank you for taking the time to attend our Health Commission meeting. Zoe, if you could advance to slide 4, please. Thank you. So, as we mentioned during the last call, the year 2022 got off to a rough start for us here at Laguna Honda with the major surge in Omicron cases that we had. We had more cases in January than we did for the entire 2 prior years. We finally got a break in February with only 52 total cases compared to 263 for the prior month. Next slide. The significant reduction in cases in February helped to return us to a relative sense of normalcy. So we were able to lift some of the restrictions that had been put into place on our visitation. We returned to normal visiting hours. We removed restrictions on the number of visitors per resident. And additionally, we refrained from testing fully vaccinated visitors. We continue to require proof of vaccination and self-administered tests for anyone that's unvaccinated. Next slide. The reduction in cases also warranted a shift in our testing cadence from twice a week to once a week for both residents and staff. This was our normal testing frequency prior to the Omicron surge. I think the important thing here is that we do not hesitate to adjust our testing cadence as conditions on the ground dictate. Next slide.
Okay.
Our organization responded extremely well to the call for getting vaccinated. Amazingly, 86% of our staff and residents have received the 3 doses, the booster. So despite the number of cases, the high number of cases that we had in January, we managed to avoid serious illness. As an added measure of protection, we began offering a 4th dose to immunocompromised individuals, and several have already taken advantage of this opportunity. Next slide. So we're in the process of preparing for our upcoming annual survey. Our anticipated survey window is between April and June of this year. Fortunately, our staff are very accustomed to this annual survey, so we anticipate a strong performance. We also have a major benefit this year that we haven't had in prior years. As you know, we transformed our quality department by adding significant resources and transitioning the department under the San Francisco Health Network quality umbrella. Moreover, our Chief Quality Officer, Naz Talai, has done a wonderful job of recruiting top talent and building a solid team here. So we're well positioned for the upcoming survey and for the future. Next slide. Here's a look at our admissions, discharges, and expirations during the last year. We halted admissions in January, thus the relatively low number due to the surge. So for the month of January, we've had 13 admissions, 4 discharges, and 6 expirations. Next slide. For our financial update, we're anticipating 15.9 million, a 15.9 million surplus in our current budget. Of that 15.9 million, 6.7 is associated with an increase in our Medi-Cal per diem rate. 9.2 million is associated with savings and expenditures. The expenditure savings is primarily driven by a 6.9 million reduction in temporary and registry staff and 3 million in materials and supply savings. So essentially, we're spending less on COVID-related expenses than we actually budgeted for. Next slide. And finally, we were able to celebrate Black History Month here at Laguna Honda during the month of February. And I want to issue a special thank you to our Black History Month Planning Committee for the work that they did in creating a meaningful and educational experience for our residents and staff. As you can see from the slate of activities and events sponsored, we had a very memorable and celebratory Black History Month this year. And as a bonus, Lunar New Year also fell in the month of February this year, so we were able to celebrate that special occasion as well. So I'll pause here and try to answer any questions commissioners may have.
Commissioners, I will, before you, thank you, Mr. Phillips. I'm going to go to the public comment line first to see if anyone would like to make comment on item 4, the executive team report. Please press *3 if you'd like to make comment on this item. *3. I do not see any asterisks. And Mr. Phillips, I also want to note that Commissioner Chow in a conversation today also noted that he wanted to make sure that commissioners and the public could ask questions about the tabs in the report as well as your presentation. So just as an FYI. So commissioners, any questions or comments? Commissioner Chow.
Dr. Chow, yeah, Dr. Chow. Oh, you're on mute.
Okay, there. How's that? Okay, thank you. I did want to ask under the vacancy reports, because now I think for several months, the radiology tech has not been, positions have not been filled. How are we doing radiology?
I can answer that, Michael. So yes, we do have as needed or pool radiology techs that we can tap into as needed, Dr. Chow. Those vacancies has been there for quite some time, as you know. There's just really no pool in the applicant. The applicant pool is quite empty and is looking very scarce these days. And luckily, Gary is able to pull in resources when needed, and luckily. Despite episodes of having positive cases that affected the department, it did not affect our operations from the medical side.
Okay, so I do note that it says that the manager is re-evaluating the position. So does that mean that you're trying to change it to maybe a higher classification, or and then meanwhile you're able to bring people in at the time that you need them?
That is correct, Dr. Chow. We are trying to see how we can entice candidates to not only apply, but also to stay with us.
And are these full-time positions then, or do they come in at call?
The ones that currently work now are the open positions.
No, the open positions.
The open positions are full-time. These are folks that retired a few years ago, and they were full-time positions.
Okay, thank you. The other question I had was actually in the number of occupational therapists. Oh, no, I circled it and I was going to commend you that you have actually a full load of occupational therapists. And I remember a time when this was really a critical need a good number of years ago, when we were actually, I think, critiqued for not actually having enough occupational therapy and activities. So that was great. Now I see why I circled that. I said that was really very commendable, and I wanted to thank you all for that. And on the finance report, on the first page, at the very bottom of the page, which is a statement from, of course, the CFO. I'm trying to understand just that the variation that says general fund report. It says that the general fund projection was 114 million. Our revised budget was 130. The original budget was 90. The variance is 15 million. So am I reading that correct as it is? I'm just trying to be sure I'm correct that the 12% is related to the projection versus the revised budget. And so if the projection was 114, the revised budget was 130, as versus being related to the original budget. Is that correct?
That is correct, Commissioner Chow. We essentially received a higher allocation in the general fund.
Okay, so it says that we have received more general fund than we had actually anticipated in the budget. So that, of course, would become a negative or a minus 12. Okay, just wanted to be sure I was interpreting that correctly, as versus whether or not we're supposed to be measuring against the original budget, which of course wouldn't make much sense. But I just wanted to clarify that, so it's okay. I think lastly, I was just going to comment on the fact that I realized that for the first half of the year on the gift fund, and thank you for the detail on the gift fund, because I think this does help us understand all the different programs that you're having. And obviously, a number of programs couldn't be held during the COVID and Omicron, particularly now, period. But I was just noting that, as I understand it, then this is actually by categories and showing us the expenditure. So I want to thank you for that, so that we can see which ones are happening, not just at the end of the year, we see that there were so many activities and what they were. So this is really helpful, and I want to thank whoever actually puts this together.
Thank you, Commissioner Chow. I'll make sure that your words of appreciation go to Bill Frazier, who puts that report together for us.
And that was the only questions I had out of the report. Thank you.
Thank you, Commissioner Chow. Any additional questions on the executive team report? Okay, great. Mark, we can move on.
Great. Item 5 is the regulatory affairs report.
Good evening, Commissioners. This is Geraldine, Director of Regulatory Affairs, and I'll be sharing the Regulatory Affairs report for Laguna Honda. The report reflects activity for the month of February 2022. Laguna Honda reported 23 facility reported incident to CDPH for the month of February, and we received 3 anonymous complaints. We had a total of 5 unannounced site visits from CDPH for the month of February, to a review of a total of 22 facility reported incidents. There was 1 unannounced visit to review compliance for 2 facility reported incidents. For these 2 incidents, the facility is back in compliance. Please let me know if you have any questions or comments that I can address at this time.
Commissioners, if it's okay, I will go to public comment first. Folks on the line, if you'd like to make comment on this item, item 5, please press *3 to raise your hand, and we will recognize you to make comments. I see 1 caller. Let me put 2 minutes on the thing. I've unmuted you, caller. Please let us know that you're there.
Yes, it's Patrick again.
Okay, I've got the clock going. You've got 2 minutes. Thank you.
Regarding the regulatory affairs report, I don't know if this will show up on the next regulatory affairs report for the JCC, but I wanted to give you a heads up that I intend to file a complaint about the record keeping on out-of-county discharges. Medical record staff should flag patients' electronic healthcare record charts that don't specify precise discharge destination as being incomplete medical records. Attending physicians who fail to document discharge destinations in patients' electronic medical charts should be suspended and have their hospital privileges revoked. This is ridiculous. It violates JCO standards of documenting discharge summaries, and you folks have got to get your IT department to mandate that those dedicated database fields are mandatory, and they must be completed by discharge planning staff. So I'll be filing a complaint with CMS and the California Department of Public Health over this issue. Thank you.
Thanks for your comments. Commissioners, that was the only comment that was posed.
Thank you, Mark. Are there any comments from the committee members on the regulatory affairs report?
I did have a comment if we had a moment.
Sure, Commissioner Chow.
And it was mostly, you know, I've really appreciated and liked the outcome of facility reporting incidents and being able to understand, and we can see that a number of investigations have been closed over the year, and the gray, I guess that's gray for investigation not started, remains. But I was then struck, it would be nice to have a trend line over these years, these 2 years, to be able to see. It appears that the number of FRIs are going down, and I'm just wondering if we could do a trend line.
We can do that, Commissioner.
Yeah, because I think that would be helpful, because then we could watch, you know, the number of these a little easier. You have it in detail every month, but I think that would be helpful to everybody, and really appreciate, like I have said in the past, this report as it is graphic, because it really makes it easy to see how well we are doing, and the outcomes of the FRIs. Thank you.
Thank you, Commissioner.
Is it okay to go to the next item, Commissioner, if there are no other comments?
I'm sorry, I guess, you couldn't hear me?
Oh, no, I apologize. No, you could.
Oh, okay, yeah. So if there were no other comments, I was saying that we could go ahead, Mark, with the next item.
Great. And actually, if I could pause, I haven't checked with you, Commissioner Guillermo, but Commissioner Chow let me know that the agenda actually states 3 minutes for the general public comment. And I'm wondering if you would allow me to go back to the person who made comment to allow him another minute, so that we're being fair based on it, because I didn't realize that it had said that. Would that be okay with you, Commissioner Guillermo, to offer that?
Yes, we should do that, since
Okay.
that was a.
And my apologies, that's my clerical mistake. So, Mr. Minetshaw, I'm unmuting you, and if you'd like another minute of general public comment, you're certainly welcome to have it now, and I apologize. I did not realize that I had 3 minutes on the agenda.
Okay, thank you for your generosity. Let me just say, generosity of spirit demands that you permanently change public comment back to a 3-minute time period. You are now just a mere 30 minutes into today's meeting, and most topics before the JCC or the full Health Commission do not have hundreds and hundreds of people wanting an extra minute. This will not kill you. Just do it. Do the right thing. Honor Vladimir Zelensky. Get this done. This is ridiculous that you're being so tight-fisted over a mere 60-second period. Grow up, folks.
Okay, thanks for that comment, and thank you, Commissioner Guillermo, for that.
Yeah.
We can move on to item 6, which is a presentation on new supportive senior housing at Laguna Honda campus.
Hello, commissioners. Can folks hear me okay?
It sounds like it's the end of a tunnel. Could you speak up a little bit, Mara?
Foray into WebEx. Is it better now?
A little bit better, yes. But if you could speak as loud as you can, that probably would be helpful. Thank you.
Okay, I'll do my best. My neighbors here will get to hear my presentation as well. Hello, everyone. My name is Mara Blitzer, and I am the Director of Housing Development at the Mayor's Office of Housing and Community Development. And Zoe, if you could go to the next slide, please, that would be great. MOCD, we are the city's housing office. Our mission is to support San Franciscans with affordable housing opportunities and essential services to build strong communities. And many of us think of housing as healthcare, so we have lots of alignment with you today. I am here representing MOCD, and some of you might know my colleague Anne Romero. She's a senior project manager here at MOCD, and she's on jury duty today. So I am the substitute, I'm the backup speaker. I hope that I do this presentation justice. We are so happy to have this opportunity to speak with you today, and I'm a bit nervous because I wasn't initially intending to make this presentation. So I'm gonna do my best. I hope that you'll ask any questions that you have of us. And also wanted to let you know that we have, I think he's on, we have Tim Dunn from Mercy Housing also here to answer questions. Like me, a little bit of challenge with WebEx, but we're hoping to share information with you, continue a conversation that's actually been many years in the making. And again, just want to thank you so much for your time and the opportunity to present this afternoon. If we can go to the next slide, please. All right. Well, this is kind of the meat. Hi, Tim. This is kind of the meat of this presentation, which is really why are we here and why are we proposing supported housing on the Laguna Honda Hospital campus? I think none of the things that are here on this slide that I will repeat for our listeners is new information, but sometimes can be helpful for it all to be in one place. We all know there is a tremendous lack of supply of affordable assisted living in San Francisco. We have some data sources to look to, including a working group finding from the Long-Term Care Coordinating Council, LTCCC, that they did in 2018, which described the declining supply of assisted living in San Francisco and a pretty significant unmet need for assisted living among the low-income population, just as the time that our aging population is increasing as percentage of our total San Francisco population. At that time, the LTCCC recommended increasing the number of city-funded subsidies for affordable assisted living, for co-locating enhanced services within affordable housing. So looking at unlicensed models of housing and support services for seniors to see if we could bridge some of the many gaps that are being observed in our kind of continuum of care of affordable housing for seniors. And then also looking at if there was any opportunity to increase the use of assisted living waiver program and apply it in San Francisco, which we continue to think has a lot of potential and want to be able to focus on here for this Laguna Honda Hospital project. The need for deeply affordable senior housing continues to be tremendous. DOS made a report in 2021 on affordable housing for seniors and people with disabilities, in which they describe that 53% of the city's affordable housing portfolio, that's MoCD's portfolio, there's about 23,000 units right now under the auspices of MoCD, and that 58% of those units are occupied by seniors or people with disabilities. So that's more than half. And that's not just units that are restricted to seniors and people with disabilities. That's all the units. That's who needs the housing, and that's who we're serving. 75% of households, 75% have actual income levels below 20% of area median income, which means largely that they are on fixed incomes such as Social Security and Social Security disability income. Most of the units that we build, however, are structurally designed for people who earn between 30% and 50% of the median income. And so that either creates a tremendous rent burden where people are paying more than half of their income on rent, or means that they can't afford it all but for a rental subsidy. Lastly, that report described how most senior units are designed, they're being built in downtown neighborhoods, and there is a real lack of affordable housing on the west side, which means there's a real inability for folks to age in place if they're longtime residents of the west side and they want to move into potentially smaller housing that more befits their current household size. They will have to leave their neighborhoods to find that affordable housing because we're just not building it on the west side of the city. We think that there are a lot of synergies co-locating affordable housing on the Laguna Honda Hospital campus. And we think specifically that assisted living or highly supportive senior housing could also serve Laguna Honda residents. So it's not something that simply serves citywide, but actually could serve the hospital and the folks who are in residence at the hospital as well. We think that their housing could target some units to residents of the hospital who can live in a community setting with services supports, That would free up, of course, Laguna Honda Hospital beds for other people who need them, creating a kind of throughput that we observe doesn't really exist in the system right now. And we think that the campus itself, which has tremendous amenities and its sort of bucolic setting, could really have a therapeutic positive benefit for residents. So we're quite excited about the opportunity to be on the campus. There's also an opportunity here to do intergenerational programming. Folks might know that former district supervisor and board president Yi had a long-time vision of creating intergenerational programming opportunities on the hospital campus. And so the version of the project that we're going to talk about later today includes not only a housing portion, which is either assisted living or independent living with extensive on-site supports, but also an adult day health center and a childcare center. And we think there's a lot of opportunities for programming activities that are multi-aged. We also are receiving, just want to point out that although this was initial vision of then Supervisor Yi, current District 7 Supervisor Melgar is very supportive of the project and has been and is intending to engage in community outreach and problem solving to help bring this project to fruition. So we are very pleased to have her support. Let's see, can we have the next slide, please? Thank you. So just a little background on MoCD and where our supported units are. You can see the point that I made earlier about how folks might need to move from their current homes across the city to find their affordable homes, because you can see pretty much the entire, we have quite few opportunities that are getting built on the west side, and that there's lots of reasons for that. Institutional racism is a key one of those, and single family home zoning is another one, which is an aspect of that. So we've been working very hard in our office looking for opportunities on the west side to build affordable housing, and large parcels of land are actually very, very scarce. And so that is another benefit of being connected with the Laguna Honda Hospital, because the hospital campus, by comparison to a lot of other locations on the west side, has relative amounts of available land that's not currently developed. And you can see here, I'm pretty sure that Laguna Honda Hospital is this orange and yellow dot that's sitting here in District 7. The orange color is senior housing. So you can see there's one other multifamily senior development that's currently on the boards right now. If you go kind of straight up from that orange dot, you'll see in the Richmond at 4200 Geary, we have about 100 affordable apartments going that we hope will start construction at the end of 2022, depending on if the competitive state financing comes through or not. But that's about it. Got to go pretty far to get to the next. It's not for lack of trying, and we're hopeful that Laguna Honda Hospital is one of our next spots. Next slide, please. So MoCD selected Mercy Housing California as the developer for this project in early 2020. We issued a request for qualifications to select a developer for this project and to allow them to enter into a pre-development loan agreement with us in November 2019. And we have since selected Mercy. They were one of 4 experienced teams that came to the table. We were quite pleased with having 4 to select from. We don't always have so many, so that was a really good indication to us that this is something that our housing developers also know to be very important and in high demand. And we're quite happy to be working with Mercy and their team of consultants and architects. We have done many other projects with them in the past, which I'll talk about in a minute, but I think we couldn't ask for better stewards of this idea, so we're quite pleased. And then pandemic happened. So the RFQ was issued in the sort of late fall of 2019, and we selected Mercy right around the time that we were all sent home. So also want to just thank everyone here for all of you looking at those statistics earlier. Next slide, please. Looking at those statistics, just so thankful and grateful to our colleagues at DPH who have been supporting our city for these past 2 years during these really tremendously difficult times. A little bit about Mercy Housing. They are many years working in California, providing housing for our lowest income neighbors. 35 years. They have more than 150 properties with nearly 20,000 residents, largely seniors, but also including families and veterans, also including homeless folks. Senior housing in particular is one of Mercy's areas of subject matter expertise. They have nearly 49 communities in California, 3,600 seniors, 30 in the Bay Area, and 4 of those developments also feature adult day health centers. And just as a shout out to Mercy for that, once you go beyond a sort of basic residential, when you start doing things like adult day health centers or other kinds of commercial or childcare centers, that is a whole different level of expertise in a mixed use development, as we might call it, and Mercy has that in spades. So they were a really good fit for this Laguna Honda site. Next slide, please. Mercy Housing California is a large and national organization. They have many different arms, including a property management company, and they manage more than 23,000 units. Just for a matter of scale, the entire city of San Francisco has about 23,000 affordable units under our own auspices, and basically under our own regulatory. So that's the equivalent of what Mercy is managing across the country. And their retention rate, which I know they're very proud of, is 98% across senior properties, which we typically assume a 5% vacancy rate. So 98% housing retention is extraordinary, something to be commended, and we're happy to see that. They also have a resident services division, and they serve a really diverse resident population, like the ones I mentioned, including seniors and homeless folks, folks with disabilities, and they're providing services in almost 50 communities already. So this is really their area of expertise. And they also have a lot of experience in housing for families and children, and doing mixed use development. So they really are top of class. Next slide, please. The developer team that Mercy brought to the table under the procurement includes an architecture firm, Herman Colliver Locus Architects, and an assisted living consultant. That was one of the requirements of the request for qualifications that we put out, Mauro Hernandez. And they have selected a general contractor that is a partnership of Guzman Construction and Cahill Contractors. So it's really a top team. And then we just want to recognize this project already to date is quite a city family collaboration across many departments, including MOCD, DPH, both DPH executive and also the hospital, Laguna Honda Hospital team, and the Department of Disability and Aging Services at HSA. And so this is, we have some previous collaborations with DPH and DOS and MOCD, and this one is the first in a while that's looking specifically at this senior housing with enhanced services. Next slide, please. All right, so kind of meat of what we're here to share with you. We selected a team. We've been meeting monthly with DPH leadership and hospital leadership. And we've also been meeting with the planning department to talk about what can be built and what can be built in an expedited fashion and what can be built and needs a rather lengthy environmental review. And since the last time that residential use was considered on the hospital campus when the EIR was completed, the law has changed. And so there are some new and different avenues available to us that were not available 15 years ago. And the Mercy team has hired experts to do site surveys and do below grade geological investigations to see exactly what we have here, which I think is a lot, considering that we've all been working from home largely for almost exactly 2 years, and we've managed to continue the dialogue and come forth with what I hope is a plan that looks exciting to you as well. So just to show, like, there are a couple pictures. I'm sorry if those are reading a little bit small on your screens. Hopefully you are able to zoom in a little bit. The image on the left that looks like a circle, that's the parcel that we are talking about doing this continuum of care development on. And then the image on the right, which is from a little bit farther away, includes that circle. And if you see that heart, which is the Mercy logo, that heart is placed on the circle. And then you can sort of see below there the new part of the hospital, and then the historic part of the hospital. It appears below on the screen. But my recommendation, if folks can, you'll see that you'll get a copy of this afterwards. You can zoom in to see how things are related. So this is what we call a conceptual plan, a very, very first pass on how to fit all of the things that we're trying to fit in onto the site. So reminder that we're looking at trying to find an assisted living component, an independent living senior component, an adult day health center, and a child care center. So again, this is going to be a little bit hard to read on your screen, but you can see if you're starting on the top, looking at it like a clock. At 1 o'clock is the early childhood education center. At 3 o'clock, 3 to 5 o'clock is the assisted living. And then at 6 to 9 is the independent living, and 9 to 12 is the adult day health center. And it is the result is a sort of circular shaped building, and then you can see parking around the outside of the building. Those are the kind of the small white rectangles. Let me do next slide, please. And then this is the conceptual plan. If you like cut the cake smack in the middle, took a section of it. This is the conceptual plan on the upper floors, and you can see that it lands a little bit in two parts that lets light into the building across a courtyard. And we've done some preliminary estimation of how many units, how many homes could be built. And so it's outlined here on the left-hand side of your screen. The independent living portion could have 115 studios and 55 one-bedroom apartments. The assisted living would have 95 studios, resulting in 265 affordable homes. The adult day health center could be between 7,000 and 8,000 square feet, and the early childhood education center could be 4,000 to 5,000 square feet, which is serving approximately 40 children in that space. And the building itself would be 6 stories. We do the next slide, please. So community outreach is a significant and important part of this work. And we can see that this meeting is here on the top of the deck. This is kind of the first, this is a public meeting, and this is the first public unveiling of this information to all the folks who are interested and following what will happen on the campus, which is why we're so excited to be here today. The outreach plan is extensive and will take many, many months to complete. There are lots of voices that we want to hear from and need to hear from. So including Laguna Honda leadership and also staff and residents of the neighborhood. Supervisor Melgar has committed to working with us to outreach with the neighborhood and community organizations. We think this is going to be critically important. In case anyone had followed what happened at the property across the street at 250 Laguna Honda, we have heard from neighbors before, and we'll really appreciate the support of Supervisor Melgar. There will be printed mailings to neighbors. There will be general community meetings. I don't know yet if those meetings are going to be virtual like this one, or if they will be in person. We have largely over the past 2 years been virtual, with a handful of exceptions where we've done community meetings in large outdoor spaces where there's been an opportunity to physically distance. So we probably will follow whatever your health guidance is. And I'm assuming in this case it'll be kind of a combination of both as we get back to being more closely together. We will have staff and resident representatives serve on a planning advisory committee. That planning advisory committee will be organized by Mercy Housing. And we have worked with Mercy on many projects where these planning advisory committees have been set up. They tend to work very well as an opportunity for concerned neighbors to have their voices heard and participate in the process. And then using our technology, Mercy has set up a website, lagunahondasenior.org, that people can go to and learn more about the project, sign up on an interest list, find out about whether they can participate in how to participate in the planning advisory committee, meet the Mercy staff, like that. Next slide, please. So our next steps, there are many next steps, but one of the biggest one is to collaborate with DPH on a traffic study that needs to be completed for the campus. Secondly, to go deep into our community outreach and feedback process, and assuming that goes well, that the traffic study is completed and that we can come to mutual agreement about how to address what it tells us, and assuming that we have enough community support to go forward. Probably the earliest that the project could be completed would be that conceptual plans could be submitted to the planning department in the summer of 2022, and the building would go into service in the summer of 2026. I say that with it's an early start, and Tim is nodding. When we were put this draft together, I don't know about putting that out there. It's so optimistic. Many things need to happen between now and 2026 for us to be able to achieve that opening date. I think everything from whether or not we could get that assisted living waiver to whether or not we pursue an option that requires a full environmental review, or whether we can do expedited permit processing. We'll have to make some choices along the way. But as the result of everyone's hard work, we could end up with approximately 250 affordable homes at the end of the day, and an adult day health center and a childcare center, which is extraordinarily exciting for us to be working at this scale, and to be working at this scale in District 7. I showed you the map before, but I really can't stress enough how rare and exciting an opportunity the hospital campus is. Next slide, please. So this last parting image for all of you is the Mission Creek Senior Community, which was developed by Mercy Housing California. Its location is 225 Berry Street. If you've been to the library that is in Mission Bay, then you've been to this building. It includes 140 units of affordable senior housing, and it has an adult day health center and a retail space and the library on the ground floor. It's beautiful, and it's meeting all of the goals that we had for the project, and I encourage folks to check it out. If you're interested, come see what is possible, because Mercy has built a version of it over in Mission Bay. That's the end of my prepared remarks. I apologize if I've gone over time. But we're here. I'm here. Tim Dunn is here from Mercy Housing to answer questions that folks might have.
Okay, thank you so much, Maura. Really appreciated you, especially given that you were standing in at the last minute. You did an excellent job, and appreciate the detail that you went into. This is such an exciting project, and as you said, the opportunities for something like this at a campus that is, just sort of unmatched is quite unique. So let me see if there's any public comment, right, Mark? If there's any.
Yeah, and it looks like there is. Let me make sure other folks know. Folks, if you want to comment on item 6, this is the time to do it. Please press *3. So you'll raise your hand and then we will acknowledge you. *3. All right, commissioners, there is one public comment. First on the line, I've got the timer ready, and you're unmuted. Please let us know that you're there.
I am, but I want to know if it's 2 minutes or 3 minutes, Mark.
This is 2 minutes, Mr. Manetshaw.
I don't understand why you keep going back and forth.
Well, just to be clear, before we begin, on the agenda under the instructions for remote public comment, it says 2 minutes per item. However, for the general public comment on this agenda, it says 3 minutes. So therefore, I went back because that was a mistake on my end. But currently it's 2 minutes, and we appreciate your comments. We'll take it back to the leadership and consider that. But right now we're talking 2 minutes. I'm going to put that on, and your time starts now.
Okay. I asked Mr. Morowitz to forward my article about why senior housing on Laguna Honda's campus is completely inappropriate and dangerous, particularly since studio units bring tripping hazards and falls risk due to assistive mobility equipment in tight quarters, such as 734 square foot studio units. Elsewhere, MOHC has advised the Citizens Bond Committee there will only be 200 units at Laguna Honda, not 265. And the whole question about supportive housing or RCFE style assisted living with supports has not been finalized. Mercy's draft master plan for the Laguna Honda campus dated September 17th hasn't been finalized since it was published. The September 21 assisted living financial feasibility analysis also hasn't been finalized. MOHC confirmed yesterday neither document is finalized. The financial feasibility analyzed 95 assisted living or housing with supportive service units plus 174 independent senior housing units. The feasibility analysis admitted assisted living would be a licensed RCFE model and would need to include market rate units for private pay clients paying up to $6,000 a month for the project to pencil out. We have no idea how many of the 265 units will be market rate units on public land, nor do we know whether they...
Thank you for your comments. Commissioners, that's the only public comment for that item.
Thank you, Mark. Now I'll turn to Commissioners Chow and Green if they have any comments or questions.
I did not.
Go ahead, Commissioner Chow.
Right. I'm actually the first thing I was interested in was what the process is, because as I see the timeline on this, just to talk about the timeline, I'm wondering where and how Laguna itself is involved. I know that Supervisor Yee, at that time as president, spoke to several of us at several health commissioners about the project and what it might mean. And I Can't recall how large it was going to be, but I'm not sure it was this large as a building, or that it was going to be as imposing, or at least according to your schematic. But had talked about several sites, and I recall that one site actually was probably on the other side of the current parking lot, which would be giving space to the people that were living in Laguna at the hospital as residents, and also enough space in the front to really kind of continue the openness that the front doors of Laguna has. I see that actually you really filled in the entire space of the front yards, and I'm just wondering because at least in my instance, nobody has come back to at least me as a commissioner to really discuss what this might mean. You might have been discussing it with Laguna itself, but I think there really is a need for a discussion about the siting of this and what it means to our residents. How does it affect the views basically that our residents have, which give them an openness, if it does or doesn't, because we're talking about 6 stories. In other words, the environment that might change for our residents in this, at least because we're filling in so much space. I think that the area that we had talked about before that seemed more ideal was more away and towards where the 4th tower would have been, which would have been, enough space to not allow people to feel real crowded or feel like they were in the middle of downtown or something with buildings right next to each other. And while I was looking at your plan, and thank you for the satellite picture, I wasn't quite picturing if we were going to change the front entrance then to Laguna, because it looked like otherwise, in order to get into our hospital, you would be going down a corridor. And if we're going down a corridor, I'm not sure that what kind of access we have, or does it make it feel like we're kind of going down one of the alleys, and what kind of environment that actually will create really doesn't look like there may be enough. Now, granted, these are conceptual. So I guess my bottom line is, what type of input have we had from DPH looking at the environment for our own residents? And will this also affect any of our licensing in terms of the need for certain types of services? Some of it could be positive in the sense that we would be offering. I remember when we talked to Supervisor Yee, there was kind of a back and forth where we could be offering certain types of services at Laguna, and likewise, it would be really helpful for the residents in the assisted living or in the independent living to be able to intermingle, just like our presenter had pointed out, and that a child care center could be intergenerational, although it looks like it's quite large from what you're anticipating. And these are larger numbers than I really remember that we were talking about. We were talking about looking like siting some sort of space on here. So I guess you look like you're pretty far down the line, and the Health Commission has not really had a chance to hear this except for today. I think that we're further than, and I think that we have a responsibility greater than just being a community hearing site. And I think those questions about how it affects our residents, how it affects our licensing, how it affects visitors is areas that we would be interested in. There is no question about the merit of adding housing throughout, and I don't think we're being a NIMBY here. I'm really concerned about the 800 residents that we have in our hospital and how that might change the type of environment and care that they are currently enjoying. So there are probably many more specifics that we could talk about, but I would have hoped that and believe that that would be something that we might have a fuller presentation about answering some of these questions, having our staff answer them to us as being how they have felt this project was, what input they feel that we still need to have in order to be able to maintain the type of environment and the type of community and, as you say, the bubonic type of environment that we have to allow our residents to feel comfortable and not make them feel like they're in downtown San Francisco. So I really look forward to further discussions. Both are important needs. That is, we need to make sure that our residents have the best opportunity to, participate in our hospital and their activities, and at the same time see if we can actually be able to assist in the housing problems that the city is facing. So it isn't to say that it's one or the other. And that's what I think I told Supervisor Yee before. It'd be great if we could find a way to work together. I just don't feel that, certainly from a health commission standpoint, we've been asked to help bring some of that concern and expertise that we have. So
Thank you, Dr. Chow. There was a number of questions and points that you articulated. So hopefully between Mr. Phillips, Mr. Dunn, and Ms. Blitzer, some of those can be answered. I will assume, though, that there might be some of the information that you're seeking that won't be available at this point, and hopefully we'll be able to continue to dialogue, since, as was said, the community outreach and the cooperation with DPH is essential here. So maybe you can start with Mr. Phillips in terms of what role so far either DPH or Laguna Honda has had in terms of the dialogue, and then if we can, I don't see I don't see Mara back on, so maybe Mr. Dunn can answer some of those points as well.
Well, I'll start, Commissioner Guillermo. So Laguna Honda has been involved to the extent that since I've been on board, this project has been, how should I say, was already approved, if you will, as a project that was moving forward. Now, obviously, with the pandemic, things slowed. But as soon as the first opportunity for Mercy Housing to kind of get some momentum around the project, they started requesting to have meetings with us on this topic. And so since that time, we've been meeting with them on a very regular basis, say once a month, because of all, we have the same issues as Commissioner Chow raised. And, we operate a hospital, we're not in the housing business. And, but at the same time, we have to be partners because, as I mentioned, the project was approved and had, significant support from the supervisors, a couple of the supervisors, as well as the mayor's office. So, we were in a position where we needed to be a partner, and that's essentially what we've done. So we've raised issues significantly, particularly the ones that you raised, Commissioner Chow, and Mercy has done, an admirable job of sort of working on trying to answer some of those issues. It's still ongoing because some of the issues are not easily resolved. And, parking is one of them, for example. But I think the main point is that we are at the table we, Laguna Honda, are at the table. We have an ability to raise questions and ask for reports, ask for analysis, and we will continue to do that. And so I'll kind of leave it here for the moment, and perhaps Tim can add some additional color.
Yeah, thank you very much. So Tim Dunn from Mercy Housing. So I think the first thing I'd just like to say is that what we really did was what we call a sort of feasibility analysis. So what Mara showed you in terms of a site plan was not, it's not what is ready to be submitted to the planning department today for approval. This is a scenario that we found is feasible. And so at this point, we are very interested in getting the feedback that you're expressing. What is the right dimension from the existing hospital, for instance, is just because we can build 265 units, is that the best plan? So we are, at this point, we're just commencing our community outreach, and so we're interested in hearing your feedback, interested in hearing the feedback of the staff and residents, which we'll be doing this upcoming month, and then hearing the feedback from the community. So there's lots of time to sort of come back. In fact, I mean, that's one of the things that we would like to sort of establish either tonight or very soon is how should we sort of engage you sort of moving forward. And then I guess I just want to there was a lot of things you said. I wanted to address. So we did look at the other site that you discussed, the site, the north parking lot, and we found that site, it had some issues in terms of zoning, some issues related to the sort of geotechnical issues. And so there was definitely some feasibility issues that posed problems with that site vis-a-vis the site that was presented this evening. There's also in terms of vision, we were having a conversation both with the Laguna Honda leadership as well as the supervisor, and it was sort of envisioned that having this new program sort of closer in to the hospital had more opportunities for the synergies that we were looking at as well. So there was a myriad of reasons. I'm certainly happy to talk more about that. And I also wanted to address the question about the entrance to the hospital. So just to clarify, it is not, what was proposed was not in front of the entrance. So the entrance is sort of on a lower level, and then the site that we're talking about is where the third tower of the hospital was proposed, and where the former Clarendon Hall was, so it's up above of that area. It's currently sort of the fenced off area. Some parking's happening there right now in storage, but it would not interfere with the entrance to the hospital, certainly.
Dr. Chow, do you have a follow-up questions? And then I'll turn to Commissioner Green for her questions.
Surely, no, I really think the responses, and believe that the last statement that somehow we have to find a way to move forward, continue to move forward, and find a solution that really makes sense. I'm pleased to hear that. That's what I was trying to figure out on the siting. So it sounds like it really is on the side and not in the immediate front sort of portico, and so that assists me in trying, and all of us in trying to understand. So it's we don't want it, or at least I don't want it where it looks like we're just going down the alley, and that's appreciated. I do think that it's important to have some sort of regular approach in which reports are brought back. Obviously, our staff are the experts in this. We've asked some questions from a fiduciary and governance standpoint that we're looking at, and hoping that it is our staff that would have to answer those questions that I think I laid out in regards to how this affects the hospital and the hospital members and our residents, and how this would be of advantage or isn't, or are there things that you would like that we could, be able to support from both sides, so that this can be a project that works. I'm glad to hear that we're not wedded to necessarily 6 stories, because I think you got to find out how that really affects the entire lay of the land there, and so I think it's the beginning of the conversation. I'm a little disappointed that as you put out your timeline, the health department, reports are not part of that, and I think they should be, in terms of not only having to work with the health planning commission, but to assure that certainly at the governance level of the department, that the health commission is also going to be supportive of this, and will see this as a benefit for our department. So I thank you for your responses. I think that's been helpful, and I look forward to further reporting and conversations, not only here, but reports back to our full commission.
Thank you, Commissioner Chow, and I would agree with you that regular reporting and necessary dialogue be key in this process, as part of our responsibility as the JCC for Laguna Honda, and also just as interested in supportive residents of San Francisco, representing not just the neighborhood, but the city as well. Dr. Green.
Well, thank you all for your answers and presentation. I am quite supportive of all the points Dr. Chow has made, and I guess I have 2 concerns. One is in the area of process, and the other is in the area of cost. And as it relates to process, I do think the entire commission would benefit from really a timeline presentation from the outset, because this was the first we had heard about it. And insofar as we have some oversight responsibilities, as well as responsibilities to the residents of Laguna Honda, it would be very helpful maybe to start from the beginning and have a moment which I think we can calendar at the commission to start at the beginning, and then also continue to update us as things develop. As I also think about process, it seems that the timeline here is really unduly optimistic, because I suspect there'll be a lot of input and a lot of concerns, and probably a huge number of individuals who want to express their ideas and their support, as well as their reservations. And it'll probably be quite different than putting something down at Berry Street, where the whole area is kind of in construction and new age mode. So it would be also helpful, I think, to have a best and worst case scenario of your timeline here, so we have a better feel for that. And then along with that goes cost, because we've been involved in the contract for refuse pickup on Treasure Island, and we thought we were under a great deal of pressure to make decisions right away, and as it turns out, everything is delayed. And I know there have been several delays just in that project alone, which is not quite the same housing, but nonetheless housing. And then I also know, and I think I sent this in, that I was quite shocked to learn that the company that I think was from Great Britain that was going to redevelop the entire California campus of CPMC has basically given that entire property back to the hospital at great financial penalty. And I'm not sure what the exact reasons were, but some of the people in the know have said it has a lot to do with construction costs and some of the barriers. And that's for housing, not to mention, something with assisted living, where I'm sure you have a lot more responsibility and a lot more boxes to check. So it would be also, I think, quite helpful to understand your best and worst case scenarios there, because if 160 is predicted, but it ends up being 40 because of some of these issues, if the land, is used and you build you know, if it works, that it could be 6 stories, but you only build 3 because of cost, and then we're still not meeting our needs for this type of housing. And these are all things that I think may not fall within the purview of the Health Commission, but nonetheless, there are red flags in the community at large, and it would be helpful for us to really understand what would be realistic, because we all agree that the need is there. And the question is, what can be realistically accomplished and with what timeline? So I'm not sure where we fit in you know, getting this type of information other than how it relates to the hospital. But these are some of the things that just cross my mind as you know, barriers, concerns, and items for further discussion.
Thank you, Commissioner Green. And I do also support a dialogue with the full commission on this project. And I don't know whether it has been calendared, agendized, or not, but I would imagine that we need to get this done as soon as possible, just to at least get the initial presentation and some parameters set in terms of you know, our governance role, our oversight role, and then our role is just as representative of the communities in San Francisco. But we appreciate Mr. Dunn, your being here. Mercy Housing, you know, in and of itself is obviously a stellar reputation, and you know what the process is like in San Francisco in terms of really not only the timeline that would be presented, but all of the voices that need to be heard and considered, not the least of which is our hospital voices right there on the campus. So thank you very much. And if there aren't any other comments or questions, I think we can continue on. And I will apologize. I have got to log off in the next couple of minutes. And so I will ask, I'd asked Commissioner Green early on before we got started if she would take over for me, since Dr. Chow had not logged on yet. So if you see me drop off, then Dr. Green, then you will, that's the signal for you to take over. Thank you.
Good. 1 if by land and 2 if by sea, huh?
Right, exactly. Okay, Mark, I think we can move on to the next item. Yeah.
Great. The item 7 is a presentation on Laguna Honda Hospital equity and cultural updates.
Hi, everyone. I'm Ami Fishman, back with you again. Thank you so much for the opportunity to present again today. Very happy to be here and share our equity and culture updates with you. I also have my colleagues, Jennifer Carton-Wade and Samrit Gruel, here to help answer any questions. So we can go to the next slide. So this is just a quick review of our priorities that we shared with you last time for 2021. Really focusing on kind of building up some infrastructure within Laguna Honda to support our equity work, trying to make our work more visible, engaging staff at all levels, and working to infuse and integrate equity and the equity framework and lens into all of our departments. Next slide. Despite continuing to deal with our COVID response as a hospital and the deployments that we talked about last time, we really were able to make quite a bit of progress on our A3 goals. This is just a little documentation of that update. So we had named inclusive customer service, respect in the workplace training as something that we needed, and we really honed in on that, specifically around communication and conflict communication in particular as a developmental need for our staff and leaders. So we planned for communication training and actually started piloting that in January. Our pilot ends tomorrow. It's the 3rd session, so we'll have more to report as we evaluate that. We recruited 15 racial equity champions across 9 departments. While not quite meeting our goal of 100% of departments represented, we did increase participation in the program by 100% from the previous year. So I felt pretty happy with that as a step in the right direction. We successfully reestablished our Equity Action Council. So that council is made up of representatives from across all of Laguna Honda and meets monthly to support communication and collaboration across all levels and departments within the hospital. We continue to work on establishing equity data metrics and processes for equity data analysis across the hospital. So we've been working really closely with quality management, medicine, pharmacy, and other groups to understand how we can do this in a more systematic way and in a more meaningful way. We've begun the process of developing our policies and kind of scoping out our delineation of what is the work of our Department of Equity and Culture. And we completed this project, which was analyzing our UO data by disaggregating across race. We had a lot of support from our QM partners in doing this. And the process, I think, really identified for us some of the challenges and the ways that our data is currently collected, the ways that it's actually inputted into our system. So we learned a lot from the process about what those challenges are that are now being, I think, really brought into the development of the new UO system. So we can be thinking from the ground up, how do we create systems in a way that has equity kind of embedded within them at the center, rather than doing a lot of complex workarounds and merging data from different sources. So we're really excited about the improvements that I think will come from that learning. Next, where am I? Sorry. So, and then we're working with our performance improvement team to develop templates and tools for integrating equity data metrics and into PIPs and into all of our PI work. So that's something that's complex and still in process. Next slide, please. So just to highlight a couple other accomplishments that weren't necessarily in our A3, but I think were big things that happened, or important things that happened for us over the year. I mentioned the Equity Action Council. We've actually not only solidified that, but I think really started to revamp it to make it more of a space of collaboration and also of shared accountability. So we're asking our departments to report out, what equity work is happening in your department, what barriers are you facing, where do you need support, so that we can, as a department, really be actively providing technical assistance and support to everyone as we're asking them to take more ownership in our equity work. We are seeing a lot of movement within the different departments. Several have launched their own equity councils. So we are seeing Health at Home has started an equity council internally, and they're meeting regularly. Pharmacy has an equity group that is also meeting regularly. Dietitians are meeting regularly to talk about equity issues in their work, and actually creating a library of relevant materials to read and discuss together. So there's a lot of kind of exciting, I think, growth and just really more conversation and engagement overall. We've also maintained regular communication strategies, so a newsletter, inclusion in our daily communications, creating and using online tools like Teams to support internal collaboration. We've been doing targeted technical assistance and support with at least 9 departments. That means sometimes going and giving presentations, doing short kind of mini equity trainings, really trying to help teams and departments get up to speed so that they can identify how is this work really relevant for us? Where is our entry point? And so that we can really support them to feel empowered and to feel a sense of ownership about how to really dive in. As mentioned before, the piloting the communication training with our nursing leadership. So we're going to evaluate that training tomorrow. We're also planning to evaluate 30 and 60 days after. And have as well some practice sessions ongoing. Our goal with this is really beyond just having a good training with interesting information, is to really think of these as core competencies that we're developing for staff at all levels, being able to navigate difficult conversations, being able to communicate when big feelings and emotions are happening. Those are the skills that we want everyone to really feel that they have, and the skills that we think are needed to change how we, how we're interacting with one another. So that's what we're really going to be looking for with that. And then our equity library, we started this library last year. We've had 45 Staff check out books primarily for their own learning. Also, some people are checking them out for book groups, but we're really trying to, again, just increase the opportunities for engagement, the visibility of this work, and just have more space where conversations about equity is happening. Next slide, please. Additionally, we conducted a self-assessment as part of the reporting out to the Office of Health Equity. So we were assessing ourselves across these 3 domains of normalize, organize, and operationalize. Again, these are the GARE, the Government Alliance on Race and Equity. This is kind of their framework of how we really transform our institution to be anti-racist, to be working actively towards health equity. So I think we made some progress in each of these domains, which was wonderful, especially again, considering all of the barriers that we were faced with in the past year. But as is not a surprise, I think we made the most gains in normalizing and organizing. So that means most of our gains were really around, again, creating more of a shared language, more normalizing, setting this as a hospital-wide priority, and then really starting to create infrastructure that can support us to do this work. So our focus for this coming year is on operationalizing and really working to implement practices and policies that will help to result in demonstrable change and improved outcomes for our residents and staff. So I want to really push ourselves to, having more concrete benchmarks, more metrics, more ways for us to evaluate, is what we're doing making a change? Is it moving us in the right direction, or do we need to reevaluate? Next slide, please. So our key strategies remain mostly the same as the ones that I shared with you previously, but I did want to highlight a couple that we've added. The 4th one is about changing the frame. And these are the ones we added, I think, are really speak to the strategy that is how we're approaching culture change, because that's really what we're talking about when we're talking about this work is organizational change and culture change. So changing the frame is about a framework that this work is everyone's work. So it's been incredibly valuable to have an actual department that can be dedicated to this work and staff that can be dedicated to this work. I think it's allowed us to focus, to have, just a consistent presence, to really get to develop strategy and act that strategy out, and to really sort of be almost acting as consultants across the hospital to build capacity, support our departments in doing the work that they need to do. And at the same time, we need to consistently be clear in our message that the work of equity is all of our work. It's not the work of the Department of Equity and Culture. We're here to really help support that work, but that in order to see the kinds of changes we want to see, we need to be engaging across all of our departments, all levels. So that's sort of I think something that we're really trying to hold very central as we move forward. And then the last one is the final one here that we added, which is thinking about, as we're trying to change the culture, change the practices of our institution, we do that in these 3 ways. So first, we set new standards and expectations, right? The conflict communication example, I think, is a good one. We haven't necessarily had a shared expectation that that people are going to talk to each other and navigate through conflict together, or at least attempt to. Not that hasn't, and especially of our leadership. So we're shifting that, right? We're saying we really expect people to be able to do this. We see this as a core skill that's required in order to, to provide excellent quality care, to have staff have positive experiences of feeling seen and validated and heard here. But in order to do that, we then need to actually train people to have those skills, right? So we can't assume that everybody's coming to the table with that same skill set. So setting the standards, training to support the knowledge and skill to achieve those standards and expectations, and then really supporting, a culture of accountability to those new standards and expectations. So that's kind of how we're trying to approach what we're doing. We haven't, we have to acknowledge the places where we haven't done the things that we say we value, and we're making those changes, and then we're going to support people to get there. Next slide, please. So going into 2022, our priorities are focused around 4 major areas. Community engagement, obviously a big one. As we were talking about in the last presentation, it's really important for us thinking about what does meaningful participation and engagement look like from our residents and family, and how do we create more opportunities and spaces for that to be possible, so people have a true meaningful way to engage with decisions that are being made that affect their lives. Sustainability is about continuing to build up our capacity to do this work and have this work sustain. So it's not dependent on individual people, but there's really structural support. Workforce equity, it was a big goal in last year's REAP and continues to be a priority for us in eliminating disparities in workforce opportunity and experience. And then health outcomes are always a priority, but really identifying and addressing the ways that racialized health disparities are showing up so that we can improve outcomes for all of our residents. And as before, as we work on these areas, we are considering all of the realms that are listed here out at the bottom. So looking across the spectrum from individual knowledge and behavior all the way to organizational culture and practice. Next slide, please. So we've been pretty busy in our first quarter. These are some of our accomplishments to date and things that are in progress. As I mentioned, we've been reformatting our Equity Council to be supporting increased accountability, really supporting our 15 champions to be moving into implementation and project phases. So taking more leadership roles in the equity work that they're trying to do in their own departments, supporting new hiring to include the equitable and hiring and recruitment guidelines that have been adopted by DPH, and that was a partnership between the HR department and the Office of Health Equity, and drafting our A3. That's going to really guide our work for the year. And then we're also have these things in progress. Many of these are carryovers from last year, but a few that I want to highlight is we've recognized that language access in terms of access to interpreter services, ASL interpretation, as well as translation has been inconsistent here at Laguna Honda and is not up to par with what we know our residents need. So we're very excited to be working with the Health Network leadership and improvement team to really, and then getting a lot of input from our staff about what are those places where this service isn't working the way that we need it to, so that we can really identify those and make improvements. So that's a new thing that has popped up. We've been hearing about it for a while, but we're starting to really move in a more systematic way. We'll also be partnering with HR and the Office of Health Equity on the respect policy training and implementation. Laguna Honda is going to be one of the pilot sites. So we'll be doing focus groups with staff and developing materials based out of that to better understand how do we implement and actualize this policy in a way that is meaningful and effective. And also we're Samrit, who's our SF fellow, who's fantastic and wonderful, is carrying on a project from our previous fellow, which is, and who is also fantastic and wonderful. And it's an assessment of our LGBTQ plus residents' needs. So we're going to be, Samrit is doing interviews with residents. We're looking at some data, and we'll be excited to hopefully share with you all what we find in terms of how we can better support and create an environment where everyone here feels really welcome and a true sense of belonging. Next slide, please. So as we move into full swing, these are the things we're working on. I've mentioned a few of these already, but would like to highlight the employee engagement survey process. So the employee engagement survey is scheduled to be made available in April. We are already working on strategies to increase participation in the survey, and I think most importantly, to really develop a plan in advance for how we want to use that data. Historically, we haven't done the greatest job of sharing out what we've learned and using it to make improvements or come up with recommendations. So we really want to shift that. we understand. I understand personally how frustrating it is to be asked to fill out, a survey or share your opinion and then not know what happens with that information. So I think it's going to be very important for us to make sure that staff know, and it's very transparent, why we collect this data, what we do with it, and how it leads to change. And then just continue to be flexible and adaptive as we hope to always be, to meet the emergent opportunities and needs as they arise. We're seeing more engagement from staff, more people calling us, more people reaching out to say, hey, I want to talk to you about this thing, or can you look over this survey we want to do with our staff. So it really does feel like there's a shift. We're starting to be able to play that role of really supporting staff across the hospital. So we're very excited about that. Next slide. I think that is it. I'll just thank you again for your time, and thank our leadership, our very supportive leadership, for their guidance and support and partnership as we learn. We are really, I think, making this road as we walk it. It's very experimental and challenging and humbling. And yeah, really want to also thank my amazing colleagues, Jennifer and Samrit, for their commitment and passion. And happy to take any questions and comments that you have.
Well, thank you so much for your presentation, and it's remarkable what you have been able to accomplish in light of the pandemic. So is there any public comment on this item, Mark?
Yes, we have one person on the line and one person has their hand raised. So I will mute you, caller. Please let us know that you're there.
Yes, thank you. It's Patrick. I am addressing the overarching issue of hospital equity and cultural issues facing Laguna Honda Hospital. So please allow me my First Amendment free speech rights to say what I'm about to say, and do not cut me off. It was absolutely shocking to hear both Commissioner Chow and Commissioner Green acknowledge that this is the first the JCC has heard about the development of senior housing on Laguna Honda's campus, because it is an equity and cultural issue facing both staff and residents of the hospital, as well as, us minor public healthcare advocates. I am going to transcribe in detail Commissioner Chow's concerns. It is shocking that this housing proposal has advanced so far without a single damn hearing by either the JCC or the Full Health Commission. You need to rapidly agendize this, get it out in the open, and allow the broader San Francisco community to comment on the wisdom of allocating the vast majority of the 2019 affordable housing bond allocated for senior housing to that isolated, dangerous campus at Laguna Honda Hospital for senior housing. This should never have gotten to this point without the
your comments, Mr. Monetchal. Your time is up. No more public comment, commissioners.
Okay. Commissioner Chow, did you have any comments on the report?
Yes, thank you. I thought that it is echoing what you have just said, an amazing amount of work done, not only because of the pandemic, but even if we didn't have the pandemic, this still is an amazing amount of work. My own comment is, as we were looking at the issue of health equity and disparities on a racial basis, I was glad to see that we had a little section on the LGBTQ, looking at that. And of course, we have an Asian focus unit, and we have several other units like that. So my thought is, somewhere here, while we are working with the employees, it would also be good for us and for the hospital to understand how this has and will affect the residents. Clearly, you've already picked up one, which is the issue of language. And I actually didn't realize, but you've identified that as a real issue, and that's really important to improve our language translation services. I'm just thinking of the fact that it would be useful as we are looking at 2023 and the work that you're creating to understand how the residents have been affected and also even their opinions about what the program does and therefore also what might be missing and what the residents are able to provide in terms of additional input into this very important project. So that's sort of the comment I have regarding this item, which, like I said, it's an enormous amount of work, even in normal time. You've accomplished a great deal. Thank you.
Yes, and thank you and congratulations to you and the team. This is really quite a body of work that you've done in a very short period of time and very intricate, very well thought out. So we're very grateful to this. I think you're holding your own in the REAP effort across the entire DPH.
Thank you so much.
Thanks.
So, are we now up to closed session?
A consideration of closed session. And let's first ask for public comment on a consideration of closed session. Any public comment? Press *3 if you have public comment. There's public comment on this item. All right, you're unmuted. Let us know that you're there, please.
This is Patrick. Before you go into closed session, I would hope that in closed session you have a very lengthy conversation about the failure of Mercy Housing Supervisor Norman Yee, Supervisor Myrna Melgar not engaging the Health Commission about a proposal to put housing on Laguna Honda's campus. You own that land. You have to approve any kind of projects on that campus. And ever since Mercy was awarded the contract in 2019, 3 years ago, you have not held one public hearing about the wisdom of doing this. You have got to come out of closed session and announce rapidly scheduling monthly hearings at the full Health Commission about this misguided proposal and the dangerous housing that you're going to create for elderly, disabled San Franciscans who cannot get up that hill safely and have no community serving amenities anywhere near. I cannot believe that it's going to take until 2026, and now that you're involved, it will probably take until the year 2030 to get Supervisor Z's proposal in 2018, in other words, 12 years after he first proposed it, to get this housing built. This puts a lie to the mayor's allegation that we...
Thank you very much for your comments. And I just want to quickly note for the record that items on discussed in closed session are noted on the agenda, and anything that's not on the agenda is not discussed. Those discussions don't just happen willy-nilly, but they are set forth 72 hours in advance. So commissioners, now a consideration for closed session.
Is there a motion to open a closed session?
I would say.
Okay.
I'll second that.
Yeah, I actually had forgotten at the beginning to really thank the hospital for having also given us a tangible evidence of their Black History Month. It was a real surprise and very nicely done. So thank you. Otherwise, I now motion for a closed session.
Great.
And it sounds like us and the city attorneys let us know that if there are two of you and one of motions and seconds, then that's enough. Give me 30 seconds, please, for us to go into closed session. People in the, there's no one on the public line, but if anyone's watching, we will be back in open session after the closed session. We are back into open session, and commissioners, if you would consider a motion to approve, I've forgotten the verbiage, to disclose or not disclose the discussions held in closed session, please. Oh, everybody is muted. I'm sorry. Everyone's muted when we come back in. So if you were trying to speak, Commissioner, I just unmuted you both.
Okay, I would move that we not disclose the discussions in closed session.
And I would second that.
All right, thank you very much. And now we are to consideration of adjournment.
And I would move that we adjourn.
We'll second that.
Thank you all very much. And this has been a long meeting, so thanks for hanging in with us.
Great meeting. Really appreciate it.